That's the lipid nanoparticle accumulating in the ovaries. They cut it off before the study was done. Where else? Bone marrow, spleen, liver, all over the body. These lipids go everywhere in the body. Next, please. The lipid nanoparticles clearly state on their safety data sheets, these are not for human and not for veterinary use. These are for research purposes only, yet they went into 5 billion people around the world. Next, please. As Dr. Malone mentioned, this synthetic RNA persists out of Stanford. Dr. Rolking's study, at least 2 months later, the RNA was still present, the synthetic RNA. Next, please. Dr. Brogna out of Italy recently proved the synthetic spike protein, at least 6 months later, was still circulating in human beings. Next, please. The spike protein is the Swiss Army knife of harm. Next, please. Next, please. This is from Dr. Morris out of Germany, accumulating in the brain, the spike protein after injection. Next, please. From Dr. Burkhardt, the late great Dr. Burkhardt. This is in the brain tissue. Anybody hear of brain fog? This is the spike protein where it does not belong, crossing the blood-brain barrier after vaccination. Next, please. Peripheral nerves. This is from my laboratory. We proved it in the peripheral nerve, that burning after the shot, where it hones to the myelin, it hones to where it should go. Next, please. Organ damage, and I don't mean the church organ. Next, please. It accumulates in the liver. Absolutely. Causes damage within hours. Next, please. More hepatitis in the liver after these injections. Next, please. Autoimmune disease is rampant in studies around the world. Next, please. We knew in 2005 with SARS-CoV-1, if we used that whole spike protein, we would induce harmful immune inflammatory responses. This has been known in science for decades. Next, please. Of course, we hear about myocarditis. This is inflammation in the heart. Next, please. This is spike protein in the heart. On the right, that is persistent mRNA in the heart tissues. Next, please. Dr. Nakahara out of Japan recently proved that 6 months later, every patient in that study that had the vaccine versus the unvaccinated still had abnormal findings on PET scan, abnormal uptake in the heart tissue 6 months after the previous injection. Next, please. Next, please. It also accumulates in your very important adrenal glands. Next, please. It also attacks the elastic fibers of the body. That's what holds your tissues together. This is in the skin, destroying the elastic fibers of the skin. Next, please. Reproductive harms, as Dr. Malone mentioned. Next, please. This is spike protein in the placenta, where it does not belong after vaccination. Next, please. This is spike protein, all those brown dots in the uterine lining. Next, please. This is spike protein in the testes. Studies out of Israel show decreased sperm counts, decreased sperm motility. These are all things everybody should have known before one shot went into one human. That would have been informed consent.